Hello, I'm Kate O'Donnell and I'm Professor of Primary Care Research and Development. I work at the Institute of Health and Wellbeing in the University of Glasgow. And I'd like to talk to you today about some of the research we are doing into long COVID. Much of my work up till now has focused on people's experiences of health and illness and how they access and use healthcare, particularly primary care and general practice. And of course, we've now seen how science is helping us to understand COVID-19, develop treatments for infections, and importantly, vaccines. And so we now also need science to turn its attention to long COVID and the challenges that people face who are suffering from long COVID. Over the past year, I've been involved in several studies which have explored the experiences of people living with long COVID, trying to understand their symptoms, how it's impacted on their daily life, and their experience of trying to get medical care. We're now able to extend this work, first with a project funded by the Chief Scientist's Office in Scotland, the Long COVID in Scotland Study, or KISS for short. Claire Hastie has told you how we are collecting data from people who had a PCR test and contacting them with a questionnaire to find out if they are still unwell, what their symptoms are, and some of the impacts on their daily life. From the people who reply to that questionnaire, we will select a smaller sample to interview. And some of those people we will interview more than once to be able to follow their journey living with long COVID. We'll ask about its impact on their health, on their daily living and on their relationships, on their work if they are in work, and how they are managing to access healthcare. We're interested in whether they're getting care from their GPs, if they've been referred to other parts of the NHS, or if they're getting care from outside of the NHS. And we want to know how easy or difficult that has been. A second study, called Redirect, is just starting. This will test whether a weight management programme that is already used by the NHS can help to relieve symptoms for people who have long COVID. An important thing with this research is that participants won't need to have had a positive PCR test to be part of the study. They can be part of the study on the basis of persistent symptoms, age, and BMI. And we aim to recruit people from general practices, through social media, and by working with Long COVID Scotland. One of the exciting things about this work for me is that we researchers are working closely with people who have long COVID to decide what are the important research topics and research questions, and to work together to design studies to answer those as best we can. This has already identified one important issue. Many studies identify people who know for definite that they had COVID because they had a positive PCR test. But of course, for many other people, they were never able to get a test, either because tests weren't available at the time, testing wasn't happening in the community, or perhaps because they had such a mild infection at the time that they didn't even realise they had COVID, but now are living with the long-term implications of that. So the next challenge is to design bigger and better studies that will include a wider group of people living with long COVID. Working with Long COVID Scotland, we hope to start that soon.